This is a paper that looks at rapid antigen testing, self-administration, and the limit of detection. The authors have concerns because these rapid tests are being used in non-clinical settings by normal people, where not only does the test sensitivity decrease with decreasing viral loads, but rapid test sensitivity was lower when performed by patients or caregivers themselves compared to trained medical staff. So the already low sensitivities of rapid testing may decrease even more due to user error. The large reason this is concerning is because low sensitivity is especially important in our asymptomatic or low viral load populations. These are our silent superspreaders. So on average, the staff-collected anterior nasal swabs had about 74% sensitivity, while self or parent-collected swabs were lower at 57% sensitivity, where the lower the viral load, the greater the discrepancy between staff-collected and parent or patient-collected samples. And this is what that looks like. So these would be classified as severe symptoms, this would be moderate symptoms, and this would be mild symptoms, with potential asymptomatic patients over here. So in general, as the viral load decreases, the test sensitivity becomes much lower. Or when you have mild symptoms or asymptomatic presentation, staff-collected samples can show up about 20% of the time, but people that are self-sampling at home, they're pretty much never getting a positive result because they're not collecting well enough. And outside of that, when we're looking at PCR positive, so these are known positive cases, these are the lateral flow assays, our rapid tests up here. When you have a very high viral load, there's a high percentage of agreement. So if you get it on the lateral flow assay, you're also getting it on the PCR test. When you go to less severe, you're losing about 20% sensitivity. When you go to moderate severity, you're having about 13%, where one of the tests aren't showing up at all in about 8 different samples tested. And then when you have that mild, moderate presentation, you're only picking it up 8% of the time on the lateral flow assays. And this is very problematic when you're having these mild, moderate, and asymptomatic cases that these rapid tests are not picking it up. They're going to give people a false sense of security. Also of note, this study looked at alpha, beta, gamma, and delta variants. So for our current XBB variants, we're already having this shrink substantially, so these effects are going to be even more significant. The two major takeaways being that user test error plays a role, variant type plays a role, and symptom severity plays a significant role on if your rapid test is going to pick up on the virus or not.